So beginning with identification and screening for high-risk patients. So I've already said that this is considered a rather taboo and difficult subject to talk about, and certainly it's an embarrassing symptom for sufferers. But I think if we normalise this with some of the similar questions presented on this slide, but perhaps with a permissive discussion around allowing your patients to volunteer these symptoms, then they're much more likely to. So the sorts of things that I discuss is, with ageing, we notice is that hair greys and falls out, and that skin wrinkles, and also we notice changes to the function of the pelvic floor musculature. And as a consequence of that, bladder and bowel symptoms become far more common. And I might begin with a discussion around bladder-type symptoms, and specifically incontinence. As I've said, that's considered slightly more acceptable, and then move to investigation of any bowel symptoms, and then from that, more generic questions about bowel habits into direct questions related to bowel leakage. And with this in mind, I have 3 particular screening questions that I use in any patient that I see, irrespective if they volunteer the symptom fecal incontinence. So the first thing I ask them is, are they ever anxious because they think they might lose control of their bowels? I then ask them, have they ever had an accident or their bowels start to empty before they reach the toilet? And I'll also ask them whether they've ever noticed staining in their underwear as a consequence of bowel leakage without having been aware of it. And those 3 very easy and I would say quite memorable questions form the basis of our first acronym and our second take-home message. So when those patients are sitting in front of you, aim to screen for the presence of bowel leakage.